This presentation addresses the medical reversal of the use of nicotine replacement therapy patches during pregnancy. To give some context to the issue that this medical practice attempted to solve, researchers over the past few decades have identified many adverse effects of smoking on pregnancy, including outcomes such as low birth weight, preterm birth, birth defects, and more, which is caused by the consumption of nicotine, carbon monoxide, and other chemicals that are carried through the bloodstream to the fetus. Yet despite this knowledge being known, approximately 6% to 22% of pregnant women in high-income countries still smoke, making smoking one of the leading causes of adverse pregnancy outcomes. One strategy developed to combat smoking habits among pregnant women and all smokers is NRT. Nicotine replacement therapy provides a temporary source of nicotine as replacement for tobacco, which assists smokers in the transition from dependency on tobacco to abstinence from their habit. Nicotine replacement therapy often includes the use of alternative nicotine sources that assist in this transition, including nicotine gum, inhalers, and transdermal patches. These nicotine replacement patches became one of the most popular forms of alternative nicotine sources and were incorporated into many tobacco cessation programs, including those geared for pregnant women. Widespread acceptance of the use of this product was supported by the release of many scientific studies at the time. One such study reached the conclusion that all of the commercially available forms of NRT, including patches, increased chances of successfully stopping smoking. Another such study found that significant reduction in smoking in late pregnancy followed interventions such as the patches, and that these interventions reduced low birth weight and preterm birth. However, some researchers began to question the effectiveness of each individual method and began to conduct experiments isolating different practices, including the use of nicotine replacement patches. The systematic review that was a catalyst to this reversal of the practice was a randomized trial of nicotine replacement therapy patches in pregnancy, which had the objective which was to assess the efficacy and safety of nicotine patches during pregnancy. In this peer-reviewed article, researchers designed a SNAP trial in which pregnant women were randomly assigned a placebo or a standard course of nicotine transdermal patches. The abstinence was determined through measurement of exhaled carbon monoxide or salivary cotinine, and safety was assessed by monitoring for adverse birth and pregnancy outcomes. The results of this study showed that there was no significant difference in the rate of abstinence between the women assigned the nicotine patches and those assigned the placebo, with 9.4% of women with the patches quitting their habit and 7.6% of women with the placebo quitting. Looking at the current state of this practice, NRT patches are still within common and widespread use. This figure shows data for the annual prescribing prevalence of NRT between 2001 and 2012, which describes how healthcare workers still tend to prescribe NRT methods, including the use of patches, specifically during the course of pregnancy. However, now medical professionals caution smokers that use of NRT patches should be highly individualized to patients' symptoms, and they also now recognize that the difficulty of determining the correct dosage and recommend careful evaluation before use. Moving on to controversies and resistance to this change in the practice, the recommended alternative to using NRT patches is often behavioral therapy or incentivization to promote cessation, but many have more trust in pharmacological interventions, which has led to resistance. Another controversy is that NRTs are often not recommended due to concerns over using a neurotoxicant during pregnancy at all, but many still believe that the risk of exposure to pure nicotine is a fair trade-off for any increased chance of successful quitting. The works cited are as follows.